Well, good evening, the final evening, and you're still here. That's a good sign. So tonight is actually just a bit of fun. So one of my passions in life is herbalism, and so what I'm going to do is give you a bit of a Herbalism 101 in a very rapid course this evening. So I don't expect you need to take notes or do anything too drastic with this, but just to see some of the benefits that we can get from herbs and some of the amazing things that we can do with herbs. And that's what I just want to share, some of that passion with you and why and all those sorts of things. So let's just start from the beginning. Okay. No. Let me just have a look here. All right. Now, to really understand the purpose of herbs and greens in our diet, we actually need to go back to the book of Genesis, and in particular to the creation as well. Now, the original diet given to the first human couple, Adam and Eve, is found in Genesis 1:29. And God said, "Behold, I've given you every plant yielding seed that is on the surface of all the earth, and every tree which is fruit yielding seed, and it should be good for you." So in modern speak, we would actually say they were given fruits, grains, nuts, and legumes. Then something happened. Adam and Eve were given the fruit of every tree in the garden, but there was one exception. We learnt about that last night, and it was the forbidden fruit from the tree of knowledge of good and evil. Now Adam and Eve failed this test of loyalty to their Creator and Sustainer of life, and subsequently were sent from the garden home lest they continue to eat of that fruit, the special tree of life, and become immortalized sinners. So at this point, there was a change. There was an addition to their diet. So Genesis 3:18 then reveals to us what this addition was. You shall eat the herb of the field. So in modern speak, that would include all the vegetables and herbs, along with all those fruits, nuts, grains, and legumes. Now this seems quite a strange thing. Why were these greens not included in the original diet? Could there be something significant to this? So let's fast forward several thousand years later into the very near future, which we're going to learn about that tonight as well. Going to go to the opposite end of the Bible, we're going to go to the book of Revelation. Now, we see the future where all the redeemed people are now in heaven, and we find that we are once again eating from this tree of life, a new fruit each month. And there's a verse there in Revelation 22, verses 1 and 2. "And he showed me a pure river of the water of life, clear as crystal, flowing from the throne of God, and the Lamb, God of the Lamb, in the middle of its street. On each side of the river was the tree of life, which bore 12 kinds of fruit, yielding its fruit each month." But there's a new addition that was not present in the Garden of Eden in the beginning. We will also be eating the leaves now for healing purposes, the green part. So we will continue to grow to our full stature in height and intellect over time as we are sustained from this tree of life and healed by its leaves. So here we find an answer to the addition of vegetables and herbs after Adam and Eve were banished from the garden. As sin entered into this world, our physical and mental well-being would be assisted by the extra healing nutrients that God put in these plant products. So around the world, all manner of greens and herbs are used extensively by people with some amazing God-given properties to them. Now there is a very old saying in medicine. It says first the word, then the herb, and lastly the knife. Now this saying was before the advent of modern pharmaceuticals and medicines. So I've put together this pyramid for a modern day version of a holistic approach to medicine. So traditionally doctors will tend to operate only in the top 2 layers, but the lower 3 layers were often being neglected by doctors these days. But first the word. Now what we're talking about here is education, based on the Bible principles of health, and it's so important. Then of course, moving up that pyramid, we get into that healthy lifestyle principles, and that's what we need to really start to adopting. So some of the herbs can actually fit into this categories, and many of the herbs in the field are not just used as medicine, but they're really good nutritional options as well. After that, in that middle tier, this comes the more interventional type therapies. This is predominantly where medicinal herbs are put in, and sometimes we do need to jump to medications and surgical interventions. All of us here at some point, most of us anyway, would have needed that at some point in time. However, much of the disease today can be prevented and managed just by using those lower 3 layers. Now, I want to say this is all in the context of what God is doing for us. So we can use these as tools, but it is God who heals us. It is Him that set our body parts in motion. It is Him that knows our physiology. He knows how we work. Those herbs don't, those foods don't, but they're just tools by which we can use to help God to heal us and restore us. So they are tools. They have not got they have no intrinsic energy or healing property within them. They are just tools by which our body can be restored through God's healing power. So I hope that's kind of made that a little bit more clear. So we're going to do a little bit of a history lesson first here. In terms of the use of plants, it's been used to treat human illness. It's as old as time itself. There's nothing new at all in the prescription of herbs. Herbs were always used as a part of the diet and healing in the Bible. In the East, traditional medicine and Ayurvedic Indian medicine have always used herbs, and these are for thousands of years. Now, in Western and European medicine, herbal preparations were actually the primary source of treatment regimes up until the 19th century. That's when pharmaceuticals began to be developed. Most of them were pretty horrendous to start with, but depending on the sources that you read, anywhere between 70 to 80% of modern pharmaceuticals are actually derived from natural sources, predominantly plants. Now, currently, herbs and plant remedies are being used by about 70 to 80% of this world population. Predominantly, that is in the developing countries. This is their primary source of healthcare, with the vast majority being unable to access conventional healthcare. In the last couple of decades, there's been pretty much a tremendous surge in the interest in herbal medicine and natural therapies in the Western world, and I'm certainly on that list. Now, why do we use herbs? Well, herbal medicine focuses on using the whole herb to harness all its benefits rather than extracted components, generally speaking. There are a few exceptions to that rule. They can be used at lower doses when compared to the extracted isolated actives to obtain the therapeutic benefits. The variety of herbs demonstrate either greater activity than expected from any of the known constituents or produce a more acceptable or modified pharmacological response. So they still are medicines, but they are gentler, and they do seem to have a much broader response. And I'll be showing that with some of those herbs that we read about later on. And no one single active constituent determines the action in the herb. Like I said, there's usually multiple components interacting with each other as a whole to produce this therapeutic benefit. Now, herbal medicines are particularly useful in treating a lot of chronic but not severe disorders common to our Western society. I'm talking here about mild hypertension, mild sugar and fat imbalances, eczema, psoriasis, arthritis, hormonal issues, functional gut issues such as irritable bowel syndrome, also things such as fatigue and stress and mild mental health problems, and also some really good immune support can be provided as well. So not the really drastic, nasty stuff, it's more the chronic, simply managed stuff that we're talking about, and mostly lifestyle-related diseases that cause those. Generally speaking, we divide herbs into 3 overall categories. The first one here, we're going to talk about powerful, then we're going to talk about the mid-range or the gentle herbs. So the powerful herbs. They are herbs that have very powerful actions and often very instant effects, can be really toxic and dangerous to use, potentially quite deadly, and they are not used in herbal practice, okay? They're usually used only as prescriptions by doctors in a very restricted fashion, and they're usually on a poison schedule. So examples there are across the bottom there. We've got belladonna, the hemlock, and the foxglove. Foxglove is what we used to extract something called digitalis. Now it's made synthetically, but that's digoxin that we use to help heart arrhythmias. But the other ones, belladonna for instance, does have its uses in other settings in medicine, but don't ever use these herbs yourself. Then we have the mid-range herbs. These are herbs that lie between the most powerful and the gentle herbs. They can interact with medications and they can be toxic if they are misused or abused. They are generally well defined chemically, and some of these are still on the poison schedule or scheduled for prescription only, whilst others aren't. So there is a bit of a mixed bag there. They do need to be used very cautiously with a very thorough understanding of their safety and interactions with medications. So generally speaking, if you're going to use herbs, you want to stay away from ones such as these. Across the bottom there, we've got St. John's wort and licorice, the licorice root. Both of those can have some potentially dangerous effects if they're not used properly. Then we've got the gentle herbs. These are non-toxic, non-scheduled. We don't need prescriptions for these at all. They are very safe if they aren't abused. They tend to have quite complex chemistry. It's hard to define the one or two ingredients that are particularly active. So the beauty of these though is they work simply and they are not harmful. They don't interact with medications on a general basis, but they are slower to work. And generally speaking, if you're using herbs to try and get a therapeutic benefit, you'll need to at least use it for about 6 weeks up to about 3 months, and then decide if you've got the benefit or not before you give it away. Some beautiful gentle herbs there. 3 of my favourites across there: chamomile, peppermint, and echinacea. So how do we use herbs? Well, lots and lots of different ways. We can certainly use them fresh or dried, such as cookings or salads. It can be a regular part of your diet. Herbs can be made into a tea in the form of something called an infusion or a decoction, and I'm going to teach you how to make these ones. It can be used as a liquid extract, which is a very permanent and quite convenient way to preserve the constituents of the herb. And basically they mash all this herb up into tiny pieces, they put a solvent through it, and then they extract that out, have that liquid extract there, and then they use that on the shelf for several years, and then small amounts of that are prescribed into liquid formulations by herbalists. And look, if I'm using these, I will often use sort of 3, 4, 5 herbs in the one formulation, and you take somewhere between 3 and 5 ml dose 3 times a day. So the doses of these though, and how they are made, are set out in pharmacopoeias. So they're very strict about how they're made. It's a dose-response relationship we're getting. You need so many grams to get a certain response. We're not just giving you a random dose of something. It's very, very well defined. Now tinctures, I'm not talking here about the home-based recipes that you often find online. We're talking about standardized formulations. They again are not generally available to the public. They are prepared by a very similar way, but they are a lot weaker. And that's because we tend to use these type of formulations, or this type of formulation, for very strong herbs. So we need a lot weaker formulation to get that. But again, this also has a very long shelf life. And then there's the extracted components. So predominantly we don't do this, but there are a few examples where you need to, such as ginkgo biloba. We need to take the extract from that rather than the whole leaf, because there are other toxic components. Essential oils, that is definitely an extracted part of the herb, and that's the volatile oil that's found in the plant. They are highly, highly concentrated, potentially very dangerous. Just 1 ml of some of these oils can actually kill you if you ingest it. So they are, generally speaking, very unsuitable for any sort of oral intake. They are used very well, however, with aromatherapy, so for inhalation. And obviously we spoke about one of these in that first night, that beautiful blend that we can use to help boost our immune system. If you're going to use any topically, you have to dilute it quite severely. So we're talking down to about 1 to 3%, and you can use coconut oil as a carrier, or particularly fractionated coconut oil, or almond oil. Tablets, very, very convenient way to take herbs, and in some ways, I actually prefer this over some of the others. It's just the dried herb put into a pill. So it is much more transportable. It doesn't have quite as long a shelf life, obviously, as the extracts do, but it's a very, very easy way to take herbs, particularly if you're not growing your own or preparing your own teas. And finally, a very important part of herbal medicine is the topical formulations. So it's very useful, particularly we've got lots of inflammatory skin conditions. It's lovely to have put some of those herbs on as a lotion or an ointment. Just a couple of things, if you're ever going to use herbs or advise someone to use herbs, even though herbs are natural, they do still contain potent active ingredients. Therefore, you need to be using these with due caution. They can interact with prescribed medications and with each other, particularly those mid-range herbs. They can have side effects and even be toxic if they're prepared incorrectly or used at the wrong dosage. So here's some safety rules. If you are going to use herb to treat a particular complaint for yourself or recommend it for others, stick to the gentle herbs. Please get some appropriate training in their safe use and their correct dosing, as many herbs are toxic when taken over their dosing range. Do your research thoroughly and understand the chemistry, the actions and the potential adverse reaction interactions of this herb. They're important to know. I will say, not only is it potentially toxic and overdose, if you don't have the right dose, you don't have enough of it, you're not going to get any benefit whatsoever. So you still need to take it within the right range that is researched, and we have a long history of knowledge of how much is actually going to work and produce that effect. I will say, seek some professional advice. You can always ask me to ensure the safety when you're using them. And these are the people you need to avoid treating. So don't ever treat young children, particularly under the age of 2, but I even, generally speaking, rarely will ever treat a child under the age of 6. Pregnant or breastfeeding women, you cannot afford to treat those either. And the elderly, or those with particularly complex medical conditions and medication regimes, as they are very vulnerable to adverse outcomes from using medicinal herbs. All right, let's learn how to make a tea. Now, 2 different ways. So a decoction is a water-based preparation for the hard parts of the plants here. So we're talking the roots and the barks. And it's made by pouring cold water onto the finely divided fresh or dried botanical. You then boil or simmer it down to just over half the original volume. The time this takes will depend on the amount you're making. So if you're making a large volume, obviously it will take a lot more. It is then strained through a tea strainer, and then you take it in divided doses throughout the day. It does not store well, so you will need to use this within the same day. So that's how you make a tea with the hard parts of the herb. Then we have a herbal infusion. So this is a water-based preparation, but it's for the gentler parts of the herbs, the flowers and the leaves. And it's made by pouring boiling water over the finely dried, fresh or dried chopped botanical. You stand that for approximately about 15 to 30 minutes with occasional stirring, and then you do the same thing. You strain it through a tea strainer, take it in divided doses throughout the day. It does not store well. You will have to use it within the same day. Now, you can use a herbal infusion method for the hard parts of the plants if you've got the powdered version. So this is particularly useful if you're putting multiple herbs into one tea. So if you've got a bark of one and a flower of another, you get the powdered version of the bark, put that with the flower, and then just pour the boiling water over and make it as an infusion. So that does make it easier if you're having different types of herbs in the one. Okay, so here goes the flashing slides. We're going to go through one after another in quite quick succession. Some of these we've already talked about through the week, so you'll recognise these. It's just a little reminder, and like I said, you don't need to take notes, it's just for your interest's sake. So, herbs in the immune system. Astragalus, a very deep immune enhancer, a major leader in the herbs for immunity, stimulates a whole host of different aspects of the immune system, can be used to treat colds and flus, but does play a much more important role in prevention of these for those who are susceptible, particularly reducing the severity of the virus. It's also been shown in some parts of the world to aid in cancer treatments alongside mainstream medicine. And the dose there is 2 to 4 grams of the dried root daily. We have the Andrographis, a very strong bitter herb. Again, it boosts the immune system in a number of ways. It's shown some very broad spectrum antiviral activity against a whole host of viruses such as influenza, hepatitis, cold sores, wart virus, HIV, and even COVID as well. You would only use the above ground or aerial parts of this plant, and that's a dose of 2 to 6 grams each day, and this is definitely one that you could never use in pregnancy. Then we have echinacea, very, very well researched, and its most important action is to stimulate the innate immune system, again in a number of different ways, but it is a lot more superficial than the Astragalus and the Andrographis. But it does work a lot more quickly. It finds its use in colds and flus and a variety of different respiratory tract infections, tonsillitis, pharyngitis, both as treatment and prevention. Also useful for skin infections, such as abscesses and boils. And the dose is 1 to 3 grams of the dried roots daily. Elderflower comes from the elderberry plant, but don't eat the berries, they'll make you very sick. This has been shown to directly inhibit the virus's entry and replication in the immune system. It helps to reduce congestion and coughs in the respiratory tract. It can be used as a throat gargle for pharyngitis and tonsillitis. Sorry, there's your dose. 1 to 3 grams of dried flowers daily. Garlic. This is an age-old culinary bulb. Lots and lots and lots of wonderful healing properties. Very potent antiviral, antibacterial, antifungal, has some even anti-parasite effects as well, but it will not harm the beneficial bacteria in the gut. Most frequently we use to treat colds, flus, bronchitis and nasal congestion. We know a diet rich in garlic will reduce your risk of cancer. It tends to lose most of its benefits if it's crushed or heated, so use it dried, either freeze-dried or below 65 degrees Celsius, or during socially free periods of time, you can eat the bulb itself, the garlic cloves itself. We also have thyme, a garden favourite. It has lots of beautiful antiseptic properties. Antiviral, it has 20 different antiviral compounds in it, antibacterial and antifungal properties. Very useful respiratory tract infections, colds, flus, bronchitis, congestion in the respiratory tract. Particularly good for treating coughs. You can make this as a throat gargle by making a tea out of it and cooling it down. And it's also great for a mouthwash for gum infections. The dose is 2 to 3 grams, the dried leaves daily, and never ever ingest thyme essential oil, very toxic. Now herbs for the heart health and also for sugar regulation. Hawthorn berry. Lots of research behind this one now, but it's a very age-old one for the heart. It improves the coronary blood flow. It improves the contraction of the heart muscle, protects the heart muscle from damage, helps with abnormal heart rhythms, lowers blood pressure and cholesterol. It can interact with medications such as blood pressure tablets, beta blockers and digoxin, for example, so always check with your doctor before taking this one. You also need to avoid this herb if you have particularly low blood pressure, and your dose there is 3 grams of the dried leaf flower berry daily. Now, if you are starting this one and you are on blood pressure medication, doesn't mean you can't take it. Like I said, you just need to do it under supervised conditions. Make sure your doctor knows and keeps checking to make sure they can lower your blood pressure medication. Okay, garlic and onions have been shown to help prevent atherosclerosis, or the build-up of fats on the blood vessel. It lowers the blood fats overall. It can provide some benefits in lowering blood pressure. It can help thin the blood by reducing platelet clumping. And to get the benefits, you only need to get 0.5 to 1 gram of the dried garlic each day for those cardiovascular benefits. Just be a little bit cautious with this one if you're going to surgery, of course. You may need to stop this a few days beforehand to stop that risk of bleeding. Olive leaf can help to lower the blood pressure. It can also lower some of the unhealthy blood fats. It can increase insulin sensitivity, which is really helpful in diabetics. And the dose is pretty small here, so 0.5 to 1 gram each day. Ginkgo biloba, you can only use this one as an extract rather than from a plant that you grow. So this herb's known particularly for its circulatory benefits. Most of us would already know about its use in the brain, so dementia, vertigo, tinnitus, improvements after stroke, and this is predominantly due to those improvements in the circulation of the blood in the brain. So not only does it help to improve the blood flow in the brain, it can also do that to the other blood vessels in the extremities, arms and legs. And the dose there is in tablet form, usually around about the 120 to 160 milligram daily, but just follow the instructions on the packaging within which you buy that. Globe artichoke, for medicinal purposes, here you use the leaves and stems or even the root rather than the flower head, which they're the more potent parts. It has shown some very promising results in reducing the bad LDL cholesterol and also the bad triglycerides. As a bonus, it can help to decrease blood sugar levels in diabetics. To take this medicinally, like I said, you want to use those other parts of the plant, and it's 1 to 3 grams of the dried leaves, stems, or root daily. Just a word of warning, you can't use this in untreated gallbladder disease, gallstones, or a blockage somewhere in the gallbladder. Now, amla is a wonderful little berry, Indian gooseberry in fact, quite a powerful little fruit that's used for a whole variety of medicinal benefits. It has been shown to lower total cholesterol as well as statins, particularly targets the LDL cholesterol, and it reduces something we call lipoprotein A. What we mean by that, there is a genetic condition by which we produce a lot of cholesterol, and it actually helps to work against that. It's the only thing that we know so far, even tablets don't work so well. And the dose is 500 milligrams daily. Then there's a fenugreek. Fenugreek seed, extensively studied for its beneficial effects on cholesterol and triglycerides. It contains a soluble fibre which helps to lower the total cholesterol. And the seed, and it can also improve that insulin sensitivity and blood sugars as well. Now the dose is a little bit difficult to define, but 2 teaspoons with each meal 3 times a day would be a really good start. The hibiscus or the rosella tea has a significant effect on the blood pressure. It can lower the blood fats, it can improve sugar metabolism, it assists with weight loss, and the dose is 1 to 3 grams each day. Then we have the little bergamot orange. So it has some wonderful effects on a whole host of things. It reduces bad unhealthy fats and increases the good ones. It actually improves the circulation in the tiny blood vessels. It lowers your blood sugar, and it's very protective against fatty liver disease. And you just use the juice and the rind of one of these oranges daily. It is extremely bitter, so you'd have to mix it with other fruits, or you can get this one in a supplement form. And bitter melon, also known as the bitter gourd, is a fruit commonly used for its potential anti-diabetic properties. It's rich in antioxidants, which can help reduce oxidative stress and inflammation. It significantly lowers blood pressure levels, and these effects are thought to be due to special compounds in there that mimic insulin and increase glucose uptake. And you can use this dried in a tea, in capsules, or you can even cook with it if you know how to. And the dose is 500 to 2,000 milligrams, or half to 2 grams daily. And then there's a special cinnamon called Ceylon cinnamon. It's been used extensively, it has been studied extensively in the context of diabetes. Now the Ceylon type is better than the cassia, as it has less of the curcumin compound, which can cause liver toxicity if it's used over long periods. Now, it has been shown to reduce fasting glucose and post-meal glucose levels. It also improves long-term blood sugar control, and it has even been shown to lower that HbA1c. If you're a diabetic, you'll know all about that. And it has compounds that can enhance insulin sensitivity, and the dose is 1 to 3 grams daily. Time to look at the gut. There are loads and loads of herbs in this category, so I've only just chosen a few of my favourites. Peppermint, a big leader in the treatment of gut complaints. It has a wonderful calming effect on the gut, helping to relieve spasms, digestive upset, colic, nausea and wind. It really helps in the case of colicky pains in the gut, and it enhances digestive processes. It's a very great option to help with irritable bowel syndrome. And it's pretty easy. You can grow this one very readily. You can use 3 grams of the dried leaf daily, or if you're using it fresh, you can double that dose. Now, chamomile, just like the peppermint, does a very similar job. Colic, wind, bloating, nausea, and cramps. It is also very helpful if there's underlying anxiety that's contributing to those symptoms. It has wonderful relaxing properties to help tension, headache, and insomnia as well. Definitely want to use in irritable bowel syndrome. And you can use about 3 grams each day of the dried flowers for this herb. Again, it's very easy to grow this one, but if you're using it fresh, you just double that dose. And what I tend to do with peppermint and chamomile around treating gut issues is I use peppermint of a morning because it actually helps you to wake up and makes you more alert. And then I use chamomile of an afternoon because it's more relaxing and sedating. Same properties in the gut, but slightly different properties in the mind. So peppermints in the morning, chamomiles in the evening. Slippery elm and marshmallow root, I've lumped these two together because they have very, very similar uses. Both have a lot of something we call mucilage, which provides soothing benefits to the upper gut, especially if there's any inflammation or ulcers. It has some really great properties to also help with constipation, particularly in the elderly. So to take this, you can put a heaped teaspoon in a room temperature beverage of your choice. Usually I use a plant-based milk for this one, but you vigorously stir it in and then drink it quickly before it goes too gluggy to drink. Ginger. Ginger is really helpful for a number of digestive complaints. It enhances digestive process, so it's really useful if you've got a sluggish digestion. It's also useful in treating nausea and vomiting. Therefore, it can be used to treat motion sickness and the nausea of pregnancy for this one as well. Do be careful, you don't want to overdose on this one. We only need the maximum about 1 gram of the dried root daily. Then we've got meadowsweet. Now this will come up a couple of times, but this herb is particularly useful when you've got too much acid in the stomach. So it's great for treating dyspepsia, acid reflux or heartburn, and stomach ulcers. And the dose is 3 grams of the dried leaves and flowers each day. You do need to avoid using this one in children or those who are sensitive to salicylates. The dandelion, the long taproot is what we're talking about here, not the leaves. The leaves will come up later, but this is a nice liver and digestive tonic. It helps to treat, again, dyspepsia, loss of appetite, and chronic constipation as well. It does actually help to promote bile production and liver function. And for these indications, you need to use the root, not the leaves, at the dose of 6 grams daily. Now, I will say you do need to be a little bit cautious. If you've got any closure in the bile ducts, any gallbladder inflammation or bowel obstruction, you certainly cannot use this dandelion root. Now, herbs in the urinary tract. Who would have thought, that stuff that you peel off the corn and throw away? Corn silk. Very, very wonderful herbal remedy. Got quite complex chemistry behind it. Very soothing for the urinary tract if there's any inflammation, both for chronic and acute conditions. This includes both urinary tract infections and kidney stones. And it does behave as a nice gentle diuretic, so not meaning that you're going to lose a lot of fluid, but it helps to flush the kidneys and the bladder. The dosing is about 6 grams of the dried green silk daily. Now, buku is a special little plant. It is a major urinary tract antiseptic. It does have mild broad spectrum cover of bugs, but is particularly good against the E. coli urinary tract infections, which is the cause of most urinary tract infections. It can be used in recurrent or chronic infections in the urinary tract and the prostate as well. The dose is 2 to 3 grams of these daily, but it does have a very potent volatile oil, so it's best not to boil this one, but to rather has a tablet or some other form. Now, there are some preparations that use different varieties of substitutions of this herb that are not safe in pregnancy, so it's best to avoid this one in pregnancy. Couch grass, the rhizome. Now, that grass that you grow on your lawn, good old couch, it's the rhizome, the little long white pieces that come out of there. It's also very soothing in the urinary tract. It calms down pain and spasms, and it can even have some antibiotic activity. It is a gentle diuretic, so it's very useful for cystitis, irritation or inflammation anywhere in the urinary tract, including the prostate. And the dose is up to 6 grams of the dried rhizome daily. Now, most of us heard about cranberries, very commonly used to help prevent urinary tract infections. It has been known for a very long time to have some antibacterial activity, and that prevents the bacteria from sticking to the wall of the bladder, and that prevents the infections. Therefore, it's really useful in those individuals who are prone to get these infections and will significantly reduce them. To use the cranberry, it's a glass of juice each day, or as a supplement that usually has a similar dosing in a dry powder or in a capsule. If you need to avoid the sugar content of the juice, then the supplement, of course, is going to be the better form. I will say, by the way, if you don't like cranberry, blueberry and bilberry do the same job. So they're great alternative options. Now, going back to the dandelion, in this case, we're going to talk about the leaf. It behaves as a gentle diuretic, helps to flush the fluid through the urinary tract. So it's also good at helping prevent infections. Again, you will need to avoid this one. Sorry, the dose there is 5 to 10 grams of dried leaves daily, but you do need to avoid these if there's any issues in the gallbladder. And if you're on a powerful diuretic, you probably don't want to add this one in either. Guys, this is one for you. The berries of this tree are famed for their benefits in treating the symptoms of enlarged prostates in the early stages. So up to 90% of men will get improvement in their symptoms and signs, with improvement in the urinary frequency, the flow rate, the retention, urinating at night, and pain while passing urine. And the dose is 3 grams of the dried berry pulp daily. Ladies, here's a few for you. So the chasteberry, or the Vitex agnus castus, it's a beautiful herb that gently helps to balance your hormones, both estrogen and progesterone. So it's great in PMS, endometriosis, fibroids, heavy bleeding, and also infertility. The dose is about 1 gram of the dried berries, not fried berries, dried berries each day. Excuse me. Another one of my very favourite herbs. Now, this is a lovely gentle herb that contains phytoestrogens. So it's a great one to grow and use as a tea. Ladies can pretty much use this throughout their entire lives, but it's great for both menopause and also skin health. And the dose is 6 grams of the dried flowers daily. Again, a very easy one to grow. Now, sage. We often use this as a culinary herb, but it's very effective for hot flushes and sweats. So, and you don't need a lot of that to get the benefits, so 3 grams of the dried leaf daily. So moving on to the herbs for the nervous system, and we saw some of these last night, so we'll whiz through these. Passion flower, herbal remedy that provides some gentle sedative properties on the nervous system, helps with anxiety, specifically indicated for insomnia, but it's also pretty good for any sort of restlessness or irritability. And it does help with some nerve pain, and the dose is 3 grams of the dried plant daily. Skullcap, the above ground parts, this herb has both sedative and calmative properties to the nervous system. Great for depression, anxiety and insomnia. It is particularly helpful when there's a lot of fatigue and exhaustion. And the dose is 3 to 6 grams of the dried above ground plants of the parts of the plant daily. Valerian, very well known gentle tranquilizing and calming herb, but as I said yesterday, passion flower beats this one. It's helpful in treating most anxiety or nervous tension states and insomnia. The dose is 3 to 6 grams of the dried root daily. You can't use this one if you're on any sort of sedative drugs or you're drinking alcohol. And we have oats. Very helpful when there's a lot of general debility and mental exhaustion, depression. Really helps at restoring the mind here. The dose is 6 grams of the dried green oats, harvested just when they're ripe. Oatmeal or porridge is a great second option, but not quite as good. Just caution with this, you need to avoid it if you have celiac disease. We also mentioned damiana last night, a restorative herb to the nervous system that treats anxiety and stress. It's reported to be an aphrodisiac, and the dose is 3 to 6 grams of the dried stems and leaves each day. Withenia or ashwagandha has a whole host of actions, but it is a mild sedative, provides some relief for stress, tension and anxiety. It also can help with learning and memory, and the dose is 3 to 6 grams of the dried root daily. Alright, hanging in there, we're nearly there guys. We're going to look at the musculoskeletal system. Celery. So celery actually promotes the removal of uric acid and other acids by the kidneys. It's very helpful in gout and other arthritic conditions that are associated with acid accumulation and even osteoarthritis. And the dose is 3 grams of the dried seed daily, and this one works really well with dandelion leaf. You can't use this one in pregnancy or if there's any inflammation of the kidneys. White willow bark, we used to derive aspirin from this bark, but it is my favourite anti-inflammatory and anti-arthritis herb with some pain-relieving benefits. Can be used to treat a whole variety of different musculoskeletal conditions, however, osteo and rheumatoid arthritis, gout, ankylosing spondylitis, and muscular aches and pains. It can also help to bring fevers down. The dose is 3 grams of the dried bark daily, but we can't use this one in children or those who have a salicylate allergy. Turmeric or curcumin is a spice that's become very popular for good reason. It's a great anti-inflammatory, great for osteoarthritis and rheumatoid arthritis. The dose is 3 grams daily, but you do need to take it with a synergistic compound such as bromelain to help you absorb it to get an activated form, and these are on the market. Just a reminder, this is a spice, so do be careful if it's irritating your stomach, you may not be able to use it. It's also not recommended if you have gallstones or blockage in the bile ducts. Okay, bog bean. Here we use the leaves. It is a bitter water herb with natural anti-inflammatory benefits. It finds its use particularly in rheumatoid arthritis or any sort of chronic inflammatory autoimmune diseases affecting the joints. And the dose is 3 grams of the dried leaves daily. Then we've got devil's claw, a wonderful herb with a very unfortunate name. So this herb is another natural anti-inflammatory with pain-relieving benefits. It's great for a whole host of things: muscles, tendon, aches and pains, lower back pain, painful inflamed joints from rheumatoid or osteoarthritis, and also gout. The dose is 1 to 3 grams of the dried tuber daily, and it combines really well with that bog bean and celery. Just a caution, this herb can actually lower the blood sugar levels as well, so you do need to be careful using this if you've got diabetes. Meadowsweet, final herb, here we go. We're revisiting this one is because it's very useful in the digestive system, but it has a wonderful effect in the musculoskeletal system as well. It is anti-arthritis with its anti-inflammatory properties, so it's also indicated for muscle and joint pains. The dose there is 3 grams of the dried flowers and leaves daily. Again, you cannot use this one in children or those with salicylate sensitivity. Take a deep breath while I go to. That's the end. Those are my favourite herbs.